Heart Hugger Sternum Support Harness, an important advance in open heart surgery. Simple and effective, proven clinical and economic benefits. The standard of care at major medical centers nationwide. Heart Hugger is an FDA-classified, Medicare-approved support harness, providing pain relief and wound support following open heart surgery. This simple device results in faster return of respiratory capacity, increased patient mobility, fewer sternal wound complications, reduced need for pain medication, and may allow discharge by the 4th or 5th post-operative day. How effective is Heart Hugger? A cardiovascular surgeon in California has used Heart Hugger as part of his post-operative treatment plan on over 700 consecutive patients. He has achieved a 0 wound complication rate. Sternal wound complications occur as a result of sternal instability and dehiscence. Patient profile is often the major factor contributing to complications. Among those most at risk are the elderly, especially older women, patients with diabetes, the obese, and those subjected to prolonged ventilation. Complication rates range from 1 to 2.3% of the overall patient population, with a mortality rate of 14 to 52%. The economic consequences of sternal wound complications are devastating. The median length of hospital stay increases from 7 to 43 days. The median hospital charge increases from $22,000 to $60,000, not including physician fees. The cost savings from avoiding just one sternal wound complication more than pays for the use of Heart Hugger on all open heart patients in a typical hospital.
Before I had the Heart Hugger, when I coughed, my sides would get so sore, I couldn't swallow and I really couldn't cough. It just hurt too much.
Deep breath in.
Return to premorbid levels of respiratory function is a major determinant in the discharge of patients. Aggressive coughing and deep breathing purge the lungs of fluid and inflate the lungs to prevent atelectasis. Recovering open heart patients are frequently non-compliant during respiratory therapy due to fear of pain. Getting into and out of bed or chairs, bowel movements, ambulating, and other normal activities also place strain on the sternotomy site.
I told her it'd be a few days.
It's hard to explain exactly if you haven't been cut in two, but you feel like you're going to come apart. I mean, you really have a conscious feeling like you're going to come to pieces, and when you put the Heart Hugger on and hold on to it, it gives you a feeling of security.
Until now, folded sheets, towels, or pillows have been used to splint the sternotomy. These prophylactic methods place only downward pressure on the sternum. Heart Hugger, however, provides lateral support to hold the sternum together, affording maximal sternal wound stability.
There we go.
Heart Hugger is a simple harness worn over the shoulders, a 4-inch wide belt around the chest, finished with handles on either end. Handles are centered over the sternal wound, one patient hand width apart. Squeezing the handles together tightens the chest belt, supporting the chest wall and stabilizing the sternal wound. Both in the hospital and at home, Heart Hugger allows patients to support their surgical wound, control their pain, and comply with their respiratory regime. Heart Hugger reduces complications, contains costs within reimbursement, and saves lives.